Watching NTV tonight. Now, we are counting down the days on the 30th of September. After the 30th of September, you will not be using or accessing your healthcare using your National Hospital Insurance and SHIF card. You will be onboarded to the new Social Health Authority portal that has several things. Some of them have been confusing Kenyans a bit, including my director who needs to understand SHA and SHIF. And in studio to just help us understand that a bit more is the Principal Secretary in charge of Medical Services in the Ministry of Health, Harry Kimtai. Thank you, sir, for joining us.
Thank you.
What is the difference between SHA and SHIF, and how ready are we for that big switch?
The difference between NHIF, SHIF, and SHA is NHIF used to be our National Hospital Insurance Fund, which is coming to an end, providing service to Kenyans as of 30th September.
Right.
SHIF is one of the funds that is under the Social Health Authority, SHA. The other funds are the Primary Healthcare Fund and the Emergency Chronic Critical Illness Fund. These are the three funds that will be under the management of the
Social Health Insurance Fund is just one of the three funds.
One of the three funds.
All right.
Yes.
With less than a week to go, there are slightly over 1 million people that have registered on that portal. Are you worried? And what is the plan to rack up the numbers?
Thank you. I know from the dashboard today, just before I came to the studio, we have registered more than 1.5 million Kenyans. And I'm not worried about the registration because the numbers are now going up. In a day, we are registering more than 75,000 Kenyans. Two, we also know that there are those members who are loyal members of National Health Insurance Fund, NHIF. We have communicated to them, we have notified them that come 1st of October, they will be receiving their healthcare insurance and other services under the social health insurance. So we expect the numbers to go up because we have communicated to them and we shall continue communicating with them.
All right.
So we expect, already we know from the previous data of NHIF that we have about 12 million Kenyans who are members of NHIF. We've looked at the data, we've cleaned this data, and we have about 9.2 million Kenyans who are ready to move to Social Health Authority. So our numbers are going to go up.
All right.
Yes.
I want us to use a few minutes we have to try and understand and make Kenyans understand a bit more what they will be dealing with come the 1st of October. But before we do that, we need to address some elephant in the room. Questions have been asked about SHA even before it starts. The contracting of a consortium led by Safaricom with other two companies to provide the integrated healthcare information technology system for the new fund has been making noise. Was everything above board?
Yes, everything was above board. I want to tell you, Bernard, that indeed we've been working with Safaricom from the time we launched the community health promoters. We invited Safaricom to support the ministry by providing the gadgets, the telephone, the mobile numbers that were issued to the 100,000 mobile suppliers, community health promoters, to ensure that they integrate into our digital system, which is called the Electronic Community Health Information System. They have been with us for a while, and we requested them to come up with another proposals to support us in digitizing our healthcare system. Indeed, they submitted their proposals together with a consortium of members who we evaluated and found to be fit, and we were given approval to proceed with them. So the consortium members of Safaricom includes Apero and Convergence. These are the two consortium members that are supporting Safaricom in delivering the digital healthcare system that we have procured.
Questions or the spotlight has been especially on Apero Limited. questions raised about its shareholding. What can you tell us?
The shareholding of Apiro, I think, is a Dubai-based company, and it's a listed company. Anybody can check. They can find who are the shareholders. But as far as we are concerned, we evaluated the documentation based on the submission by Safaricom, and we found it to be above board. All the paperwork are correct. They are in order, and therefore, that is the reason as to why Safaricom and its consortium members were awarded the contract.
All right. I will leave it there for now, Bwana PS. Let's take a look at what Kenyans are contributing. Lots of focus has been on the 2.75% that salaried Kenyans will be contributing to the fund. Many saying it's too steep. What is the picture from where you sit? And also, where do non-salaried Kenyans come into this new healthcare fund?
Ben, where I sit is that for a long time, many Kenyans, about 53%, have been contributing their more than 5% of their income, about 5% of their income, to support our healthcare insurance system. And we looked at this in terms of equity, are all Kenyans contributing? And we looked at the contributions, the average contributions of all Kenyans, and said, if all Kenyans contribute 2.75% of their income, then there will be equity, and we'll be able to support each other in delivering the social healthcare insurance system of the country. And therefore, we want to look at, if you contribute 2.75%, what are you going to benefit from? We know that previously under the National Health Insurance Scheme, there are those who are getting what's called enhanced schemes. What they used to cover what's called the super cover for those who are paying more, and others who are having the national cover. So this time, every Kenyan who has paid their contribution of 2.75% will be entitled to equal benefit package without differentiation. So we are all going to be equal. We are going to get the same services, the same benefits in terms of treatment without discrimination, as long as you're paid their 2.75%. So there is more to it, because we say that what you are getting from the previous NHIF,
right,
you are going to get more in some of the benefit packages that we shall issue. We have like inpatient, we have like those who are having cancer, we have those who are under dialysis.
Right.
For example, I'll give you just a very quick one. When you've been diagnosed with the cancer, sometimes you're required to go through various chemotherapy sessions. NHIF used to give, say, if you are supposed to go for 8, they will say they only cover 4. This time we have said, as long as the doctor has prescribed 8 sessions of chemotherapy sessions, all the 8 must be covered. So that's why we say it has been enhanced. It has more because of the more services that you get. If you go through radiotherapy, if they say it is 15 sessions, you will be taken through the 15 sessions without denial. So it is more enhanced. It has more benefit package to all the contributors of 2.75%.
In a minute only, critics have been saying we shall be paying more for less, and you say that is not true. Quickly summarize for us. I've seen a kind of a pyramid with the levels of the 3 funds. Very quickly, how do the 3 funds work?
How the 3 funds work basically is we have the primary healthcare fund, which will be offering services at level 2 and level 3.
Right.
That means you will be able to visit the health center, the dispensary hospitals, and you will be treated and you walk away. Now, the social health insurance fund will set in when there is a referral case, say you need to go for further treatment at level 4 and level 5 and level 6. That's where now your contribution of 2.75% sets in, and you will be treated based on the benefit packages that we have just mentioned among them. There is what's called the emergency chronic critical illness fund, which every Kenyan will be entitled. One, for the first time, emergency treatment or care will be provided to Kenyans. Our constitution, and specifically Article 43, subsection 2, talks of every Kenyan is entitled to emergency care. So the emergency fund will take care of any emergency care that any Kenyans will be faced with. The other one will be critical chronic illness fund, which will then support Kenyans whose benefit packages under SHIF have been exhausted.
All right.
So we've costed this, and we looked at if Kenyans, we know the burden Kenyans have been going through, because when you're still in critical condition, you're still sick, you have not healed, and you're having chronic disease, you still require treatment. And sometimes you exhaust your social health insurance funds. So in that case, the emergency chronic critical illness fund will set in. All right. So we have actually cushioned Kenyans in that case.
Okay.
Yes.
Now, when you talk to Kenyans about NHIF or the National Health Insurance, a lot of scary stories come your way, and it has been bedeviled by many problems, including, not least, fraud through dubious claims. How does SHIF or the Social Health Authority system seek to cure this?
Thank you. I think why did we go for the integrated health information system? We believe that for us to deliver universal health care coverage and the problems that National Health Insurance Fund was facing, cases of fraud, right, it was very difficult to investigate because we are doing or using manual records. We have digitized our health ecosystem from end to end. All our private, public facilities will be able to speak to each other using this integrated system. So whether you go for treatment at the private, you will still be visible at the national data, because we are creating what's called the registries. We shall have the patient registry. We shall know which patient are we treating. And the patient registry, we are confirming it from the National Registration Bureau, right, where your ID records are all domiciled. So that means our single source of truth will be the National Registration Bureau. We are also going to have a registry of the doctors who are providing service, who are treating these patients. Who are they? We need to know them. We also want to know these facilities that have been licensed in the country. We must have the registry of these facilities. So our system is going to be integrated, and it will provide an opportunity for us to see those who are perpetrating fraud, right, those who are claiming that they're treating patients and submitting claims to NHIF before. Two, we've looked at the system. You see, the EACC did an audit of the NHIF system. And what they found out is that there was a lot of fraud just because an officer has an authority to initiate, to approve, and to make sure that that claim is paid. So it was all subject to an officer. This time we have laid layers of approval. The user, what you call the users, we have the user rights that have now been defined clearly. Thank you. So without the integrated system, it will be very difficult to... So
the system sorts that problem out.
The system sorts out that problem.
My final question to you, Bwana PS, before I let you go very quickly. My grandmother in the village, who does not understand the Emergency and Chronic Illnesses Fund, will need to be going for her blood pressure medicine on the 1st of October. What is your big sell to her about SHA?
The big sell, Ben, is I want you to register your grandmother. Once your grandmother has been registered, you will know how much she is entitled to pay, because you'll go through what's called the means testing process, and whatever she will be advised to pay from the means testing tool, and if you pay for her, she will be entitled to the 3 funds. One, she will be entitled to, when she goes to the dispensary or the health center, she will be treated and she will go back home. When she needs referral, she will go to the level 4 hospital, level 5 hospital, depending with the type of treatment that she needs. And I've told you, this time the package is bigger, it is better.
And she will actually get medicine.
And she will get medicine in all our hospitals. One thing that I want to inform you is that this system that we have said, it has got track and trace. That means it will be able to track all the drugs from our KEMSA stores all the way to our facilities, and we will know how the drugs have been dispensed. So she will be comfortable.
Thank you, sir. We have to leave it there because of time. Thank you for joining us tonight and helping us put a bit more perspective to this. Harry Kimtai, Principal Secretary in the Ministry, in the Medical Services Department at the Ministry of Health, talking to us about the Social Health Authority. Of course, Kenyans have about a week until to migrate from NHIF to SHIF and SHA. You're watching NTV tonight. Let's take a quick commercial break. When we come back, we'll be taking a look at the business and sports.